Hello, my name is Colleen Hughes, and I'm going to be going through the wrist and hand evaluation. So if we do not see a clear deformity, we are going to clear the cervical spine. So I'm going to have you look up to the ceiling, back down. Does that alter or change your pain?
No.
Look over your right shoulder, then over your left, back to the middle. Does that alter or change your pain?
No.
Then we're going to have you bring your ear to your shoulder, other shoulder. Does that alter or change your pain?
No.
Then you're going to have you bring your chin to your chest. And then back up. Does that alter or change your pain?
No.
Now we're going to go through active elbow range of motion. So we're going to have you flex and extend your elbows. And then also pronate and supinate. Perfect.
Then we're going to have you actively flex and extend your wrists.
And then ulnarly deviate and radially deviate your wrists. Back and forth. Okay, now we're going to do passive range of motion. First we're going to do passive flexion of the elbow, passive extension of the elbow, flexion, extension. We're going to do passive pronation and passive supination, which I'll do on the side as well. Passive pronation, passive supination. And then for passive wrist extension, passive wrist flexion, and then passive radial deviation and ulnar deviation on both sides. So extension, flexion, radial deviation, ulnar deviation. And then if we suspect a fracture of any kind, we would insert the compression distraction test or the squeeze test. You're going to compress the wrist inwards and then distract. And then for the squeeze test, you'll just squeeze across like this on the wrist. And that should reproduce pain. And then next we are going to do isometric resistance. So first we are going to do elbow flexion and extension. Have your arm bent in here. Hold strong, elbow flexion. And then hold strong, don't let me move you. Elbow extension. And then have your wrist like this. Hold strong, wrist extension. Have your wrist like this. Hold strong, wrist flexion. We're going to do pronation and supination. So you're going to grab their hand like a handshake, then resist in both directions. So pronation, supination. And then lastly, we're going to resist ulnar deviation, so hold strong, don't let me move you. And then radial deviation, hold strong, don't let me move you. So we are going to be going through the special test of the wrist. So we're going to start with the valgus and varus stress test of the wrist. So here you're going to support proximally, take the wrist, and then for the valgus stress test, you passively abduct, and then varus, you're going to passively adduct towards hand. And then next we're going to be going through the Finkelstein test for de Quervain syndrome. So you're going to ask the athlete or patient to tuck their thumb under in their palm, wrap the fingers around it, and actively ulnarly deviate. And it should reproduce pain. So actively ulnarly deviate, and it should reproduce pain up these tendons. And then next we're going to do the Watson's test to test for the scapholunate ligament instability. So you're going to take their hand, bend the elbow. You're going to apply a pressure on the scaphoid right here. So you place the athlete into extension in ulnarly deviation, and then you're going to passively put them into flexion and radially deviate. And when you let go of your thumb, you should feel a clunk of the scaphoid. Next, we're going to do the TFCC compression test. And here you will take the athlete's arm, you'll have them their elbow bent again. Okay. And you support and stabilize the wrist at the radius and ulna proximally, and then you grab the metacarpals and you're going to passively ulnarly deviate while applying axial compression to compress the TFCC. And then next, we're going to test for carpal tunnel syndrome of the median nerve. So first we're going to do the Tunnell sign, where you just take the wrist and you tap over that carpal tunnel with the median nerve, and you just tap over that. And then also you can do the phalanx test. So you tell your athlete to put the dorsal sides of their hands together like this, making sure their elbows are level, and they would hold that for a minute, and symptoms would reproduce. So the symptoms could be paresthesia or numbness, tingling, pain. Now we're going to be going through the finger and thumb portion of the eval. So the finger and thumb, like active range of motion. So you're going to tell your athlete to just flex and extend their finger and thumb. And then you can do passive range of motion. So you're going to do just passive extension of the finger, passive flexion. You can also do this on the thumb. So passive extension, passive flexion. And then if we suspect a fracture or any trauma to the fingers, we will do the compression distraction test. So you'll just take the finger, compress up, will cause pain, and then distract. You can also do this with the thumb. Compress, distract. And then next we're going to do the isometric resistance. So have your athlete bring their hands like this. So hold strong, don't move you. This would be extension. And then if you want to test the distal extensor tendons, you would just go on the distal phalanx, hold strong. And then you can also do thumb extension. So have your thumb up, hold strong, don't move you. And then for flexion, you have their athlete bring their fingers up like that. Yep. And then bring their hand down. When we test for the flexor digitorum profundus tendon, you want to resist the distal phalanx, so hold strong, don't move you. And then for the flexor digitorum superficialis tendon, you would resist the proximal phalanx, so hold strong, don't move you. Same thing with the thumb. Have their thumb flexed. Hold strong, don't move you. We can do finger AB and adduction isometric resistance. So for abduction of the finger, you have them away, hold strong, don't let me move you. And then for adduction, we can have them bring their fingers out and then bring our fingers in and press towards each other and see if we can pull them out. AB and adduction, so have them abduct their thumb this way and then hold strong, don't let me move you. And then for the other side, you test adduction, so hold strong, don't let me move you. And then next we're going to go into the ligament testing of the finger and thumb. So first we're going to test the finger ligament testing. So you want to support the base of your finger.
And then apply a varus and then a valgus force to the finger.
Like that. And then for the thumb, you want to test the UCL. So once again, you support the base of the thumb and you abduct the thumb like that. And that is the end of my evaluation. So thank you.